Hello, everyone. I am Nika Thuda, and I'm the board chair of Women in Health Together for the Future. It's my privilege and pleasure to welcome you all today to the webinar. And we have our moderator, Professor Godwin, with us, and we have our speaker also, uh, Professor Addis Abeba with us, and Godwin will do the details. Let me very briefly talk to you about Women in Health Together for the Future. And we started as as part of an international network in 1991. And we continue to be, I mean, we still today we are part of, we contribute as a partner to TUF, but now we are registered as a separate entity in South Africa. And we have, and of course, it's in the University of Western Cape Town, College of Community Health Sciences, and we have a secretariat and an office in there as well. So we hold weekly webinars, monthly, sorry, we have monthly webinars, we have other activities, we have committees, we have research committee, program committee, social media committee. So I invite you all who are not yet members of the organization to please visit our website, and you will find that there are different levels of membership, and you can, depending on the region that you belong to, and you can take a membership. We also offer for you an associate membership, so that for the if you're not sure whether it aligns with your mission or not, you can become an associate member. You don't have to pay any fee for that, but we would love to have you all contribute to the organization in any form you like. You can even email me directly with your suggestions. So it will be wonderful to have you on board. Um, the webinar, we have certificate as well. And for that, you will get a link, I think, in the chat very soon. You'll receive an email also, so that you will have an opportunity to fill the form. And then once you fill the form, you will get the certificate of participation of this webinar. So I welcome you all, and I hope you have an inspiring discussion, and you will find this useful. And within you can generalize this to your context as well. So thank you. So I leave it to you, Dr. Professor Godwin Acha, to please. I didn't do justice with your introduction,
Yeah,
but he
that's
has been
fine.
our
That's
founding
fine.
member, and I think the speaker has also been with us as member, since
Okay.
2005. So you can introduce yourself as well as the speaker. Thank you, Godwin. You can take
Thank,
over now. Thank
thank you
you.
so much, Niga. Thank you. And for those who are joining us for the first time, Nigat is the chair of WHTF, and she's been with this organization forever, and she's one of the founding members of WHTF. So thank you so much, Nigat. Um, we are privileged today to have Dr. Addis Abeba, Salinas Urbina, as our webinar speaker on a very crucial, critical topic, women's health and sexuality in Mexico. She is a seasoned academic of no mean repute, and she is eminently qualified to speak on this topic. And just by way of introduction, I know you've read about her already, but let me just go ahead and briefly read her profile so that you know that we are so privileged to have her. Addis Abeba Salinas Urbina graduated from the Faculty of Psychology, National Autonomous University of Mexico. She is a health psychologist and holds a PhD in collective health sciences from the Metropolitan Autonomous University. She works at the same university since 1993 as a full professor since 2011. Her academic interest and teaching activities at both undergraduate and graduate University programs include health promotion, gender studies, and women's sexual and reproductive health. Dr. Salinas has collaborated in institutional programs to promote students' health and to avoid gender-based violence at the same university. She's also focused on qualitative methodologies, lately in autoethnography. Before entering the role that she is currently holding in this university, she worked at the Department of Epidemiology of the Ministry of Health, and she also served as a clinical psychologist at a government primary health care center in Mexico City. She has been a member of Women and Health Together for the Future for over 2 decades. I remember meeting her at several of our meetings. So, Dr. Salinas Urbina, we are happy that you are here, and the webinar floor is open for you to deliver your presentation. Thank you so much.
Okay, thank you. Thank you, Godwin. I'm very happy to be here. Okay, I'm going to share my presentation. I think it's here. Do you see?
Yes.
Okay, let me move something here. I don't want to see me. Okay, I will start. So it is I make a selection in this presentation to present some data of this of one book. I'm going to talk about this later, and I want to present this today. Topics of presentation. We are going to start with definition of sexuality, some reflection about it, because we don't have a lot of time to make many reflections. I would like to write in your book or maybe in the chat. What do you think when you hear the word sexuality? And maybe we have time at the after the presentation to talk about this. The first word that you think about this. Then I'm going to present different views of sexuality in the field of health. They are direct, indirect, or no existent. And finally, I will present, if I have time, of course, let me move this. Some information about experiences and research that I participated in all of these years. Okay, sexuality is a central aspect of being human, present throughout life. It encompasses sex, gender identities, and roles, erotics, pleasure, intimacy, reproduction, and sexual orientation. We can see in this definition that it's a very complex aspect, issue that we have to pay attention. And in the health field, sometimes we think about these topics only with one lens. It is the biological aspect. The experience of sexuality is a universal phenomenon, but it is asymmetric. For women, the erotic freedom has been systematically shaped by gender mandates that relocate their desires to an external will. It is important to say because it's not the same for men and for women, and we are going to talk about this. We are going to deal in this aspect. So we are going to think what it means by sexual health. Sexual health is not an issue that we have to learn or have to promote specifically in our health systems. Yeah. So, but it is an aspect that as a personal health or professional health, we can promote in others, and it is very necessary to do. So we have to consider, beside the biological aspect, social, family, friends, and now we are to face another aspect that is the social media. So we have to consider all of the things, but it is not easy because we don't learn about these aspects in any institution. Oh, I'm not one to generalize because there are some institutions that promote these aspects, but usually don't do. So it is important to consider. These three approaches to sexuality for me are very important, and I divide this direct. Many issues, many aspects are focused directly in the medicine. They have associated with reproduction. If we are not living what in these periods, it seems that doesn't exist. In the direct, we talk about the natality, mortality rates, but all around the reproductive aspects. When we are talking about indirect or plural, we are mentioning some issues that are which are affected by the sexual component. For example, diabetes or other illnesses are associated with the medications. They affect the sexuality. But generally, we haven't paid attention of these aspects in the health services. And we have the last aspect, and maybe is the worst, that is the sexuality denied or no existence. It seems that the violence does exist, and if it doesn't exist, we don't try it. So we are going to explain what are we talking about these approximations. Okay, reproductive lives. One day, once I assist to a conference, and the presenter said, in our country, it was Dinamarca. The age of the first sexual intercourse is at 16 years old. And he asked us if we consider that it was a problem. And all the audience say, yes, we think that it is a problem. And he said, it's not, because we have our adolescents start in this period, but they have a long time when she has the first pregnancy. So it is important to consider that in Mexico, the average age of first sexual intercourse is around 70 years, and first pregnancy around 20 years. What happened in these 4 years? And it is the best case because sometimes at the first sexual intercourse, they get pregnant. So it's more difficult to face. In other countries, for example, Spain, it is the first event is around 70 years or so, but the age at the first pregnancy is 32 years. Many years pass before this second reproductive event. So we have to consider what happened in this period. And we, we also found this difference in our country. For example, Mexico, 22% person, woman, not unprotected and first sexual intercourse. In Mexico City, it was better. It is better, 30%. Meanwhile, in Chiapas, it's 72%. Chiapas is considered one of the poorest state in the country. It has the less education, health. The poorest people live in this state. So it has this difference. In this image that you can see here, condom vending machines. It's we make a project, and we try to install these condom vending machines in our university. We try to install three condom vending machines. It was very important for us, but it's not for everybody. We had a secretary in our institution in that time that he tried to avoid first to install these machines, and then he was not sure if we need to if the students need to pay the condoms. And we said, it's not necessary. We can to put the machines and it will be free for them. Condom will be free for them. And he says, I'm not very sure, because if they don't pay, they don't value this strategy. So we didn't understand. This is one of the aspects that affect the responsibility of the population. So we have to be aware of this kind of behaviors. Other aspect that it is included in this direct sexuality is the marriage and unions. Since few years ago, we have no interested in these problems. Marriage, unions, in this in a younger age. Now we are trying to pay attention. In this diapo, we can see some difference. Mexico get married around 26 years in women. Meanwhile, men at 29 years. And I also, we can also see this age in Spain, that it is other different. What happened? This woman had the opportunity to grow up, to have to more studies, to get better jobs, and to be independent, economic independence. When the marriage is in a short age, it is difficult for her. There is an interesting study that shows that sometimes the woman get married in this young age, and they decided to get divorced in 2 years after, and it is the best decision, because they are living in a violence, and the best thing is to get divorced. Why is protection no use? It is important to explain this different aspect. 28% unplanned sexual activity. Oh, what happened here? We don't have the education, the sexual education in our society, because it's not only the schools, it's not only the family, is also an issue of the society. Didn't know how to protect themselves. Oh, we are talking about, oh no, it is very dangerous. Yes. And the other aspect is there no intention to become pregnant. Whatever decision, there is no option because they don't have the opportunity to be responsible and to get a contraception in order to prevent an event like this. Now, I want to explain some aspects that I think are different in men and women in the expression of sexuality. What happened in our society? In women, men explore their bodies. The genitals are more exposed and they have the facility to explore their bodies. We promote in our society the pleasure. We motivate they to have sexual relations. There is another interesting book, article, which mention that in the case of the men, sometimes there are others who guide them to have the first sexual intercourse, even though they don't. The adolescents don't ask for it. So it's the facilities that the action that promote the society. It is very common that they have different experiences and it is totally accepted. They have several couples. They also enjoy the sexuality and they have the opportunity to share with others the experience. And it is good for the society. It's good to see that. Also, they know their body. If they have the opportunity to explore their bodies, they know their bodies and they know how to, they know what is pleasure for them, what parts of their bodies lies to be touched. It is a very specific aspects that in the expression of sexuality that they live. In the other hand, woman, the sexual expression is start when the menstruation beginning. It is the first sign of the sexuality. We associate it with reproduction, and is another way to face the sexuality depend on pleasure that the partner gives them. In our country, we usually don't say what is like us because it is prohibited. Enjoy sexuality, pleasure is not for us, it's for men. So these are some differences. Generally, we have one couple. There are many women that have only one couple in their lives, and it's different with men. And we repress their desires. If we talk about this, it is not good. There are pressures and moral pressures, and we don't feel free to express our desires. Other aspect is that don't know what the life of their body, because always or almost always we depend of the pleasure that our partner gives us. Some studies express that when we ask men, how many couples have you had in your life, they try to say more than that really they have had. And in the case of a woman, he tried to say less partners because it's not good for her. What happened here that we have promote that sexuality is in the case of the woman is only for reproduction and is not for to have pleasure. So okay, then it's a little video that I'm not present because we don't have enough time. But I wanted to talk about this. It was a very interesting presentation that it was in the pandemic period, and it was in the TV. In the TV, it expressed. It tried to describe the difference between condom extern and condom intercondom and extercondom. They didn't call a woman and men a condom, and it was a very interesting presentation. But it also has many moral comments because about specifically what was the institution of health present this type of information in the TV at 7 o'clock. So we have to work a lot about this kind of topics. Okay, following with this direct sexuality, we have to talk about the fertility rates, and we also see difference here. Midwife in Mexico died 40 women per 1,000 women every year. In Spain, happen died 5, and in Niger 150. We also can this difference, and I wonder if it is possible that one woman who is who get pregnant and who has the illusion to have children is fair that have to die for be pregnant. So we have to think about these kind of things because it's not only a biological aspect. We have to think that if we don't have an integral sexuality education, we are going to repeat this type of situation, and it is not fair to die for one of these aspects. I don't know how is my time. I think I have some minutes more. Okay, I would like to only show you this difference, that it is not that these deaths don't happen because it is normal. It happened because we are the better or the best or the worst condition to be here. Oh, someone want to say something? Okay, for example, in Mexico, 34 women died.
Sorry, Badri, could you mute yourself, please? Badri, thank you.
And we come to see, for instance, like in Poland, died 2, in Norway 1, in Italy 6 women. So it's not only a biological aspect. We have to consider many aspects. And we also have this difference in Mexico. It's terrible for this year. I don't know why it moved. For in 2025, we have this difference. You can see, for example, in Mexico City, by 2024, around 25 women per 100 million births, and it is different with Durango, for example, that died 61. Okay. Now I'm going to diapos more, and I'm going to talk about the indirect of blurred sexuality. And we have, for example, in Mexico City, the prevalence of female sexual dysfunction was 35%, 17 in women under 30, and 60 in women over 40. One of the 9 suffer from dyspareunia. These aspects, we don't pay a lot of attention about this because they are not associated with reproductive health or with reproductive health. And is this a case in Mexico? Half of men over 40 years old have erectile dysfunction. If they have diabetes, that risk rise dramatically to 77%. I forgot the numbers. Okay, so it is in the case of the men, but it could be also in women that illnesses are associated with sexual problems, but we don't attend them because they are not directly associated with reproductive health. Other aspect that we have to pay attention is the shared responsibility in raising children, because we usually focus on women, and we thought when I say we thought, I was thinking about the society. Me, maybe many of you, are in the same situation. But it's necessary to share responsibility in raising children. In Mexico, we start to think about this some years later, and in Mexico in 2021 we approved an law that the paternity leave full pay for 15 days. It was the first steps to improve these aspects and to include the man in the responsibility in raising children. But we have many things also to do. We have to need more about this. There are countries that have that start with these laws many years before. And the other aspect, deny or non-existent sexuality, we need to talk about sexual violence. And almost half of women in Mexico have experienced sexual violence at some point, and we don't pay attention. It is not associated with reproductive health. I have a case and I interview a physician, and one of them said that he attend a person who he suspects that have sexual sexual violence, but he didn't do anything because he think it's an intimacy problem. So we have to advance on this kind of answer to our woman. Female sexuality is still viewed under moral judgment. It say Leonor, a 24-year-old young woman medical intern. We have to do more about this aspect. Another expression of this is child is not a safe way to live sexuality free and with responsibility. It's a Elba, a 20 years old young woman, doctor and single mother. We have many spaces of control. Parents such as Miriam, Hortensia, Hilda, and women who have not yet been able to escape those circles of violence invite us to a necessary dialogue in society, in work, at home, and especially in our health services. Okay, all of this information is in this book. It calls reflection about 5 aspects that affect the woman's health, and it talks about different issues: mental health, vocal health, and if you wish, I invite you to visit our book and to review what we present in these different aspects of the health of the woman. Okay, thank you for your attention. Here is part of the
you so
reference
much.
that we use.
Thank you so much, Dr. Addis. Well presented, and thanks so much. And dear participants, she has highlighted very key points, which I will summarize. She noted that sexuality is actually a central aspect of being human, and that the experience of sexuality is a universal phenomenon. She also noted that sexual and reproductive health extends beyond biological concerns. It is a matter that implicates all society. She highlighted 3 key approaches to sexuality: the direct, indirect or blood, and then the denied or non-existent. And she specified very clear examples to illustrate those approaches. At this point, do you have any question to share? I went through some of the comments in the chat box. Thank you, Kamani. I guess she has left already because she's catching a flight. She noted that what you have shared are very similar to the sexuality experiences in India. And then Joseph Doye also highlighted that early sexual debut is also the same, very similar in Kenya. And Sureka noted that the landscape of early sexual encounters for women in India is driven by a tension between traditional expectations and the realities of digital globalized youth culture. She also noted that rural-urban migration is also one of the factors. And she also mentioned that we don't seem to have comprehensive sexuality education that is standardized in India. Maybe in Mexico is different, I don't know. So, how is the comprehensive sexual education in India? I mean, in Mexico? Do you have a standardized curriculum that is used, or is just the same?
No, that's a problem because it in many cases depend of the professor, their abilities, the experience, the different view to face the teaching of sexuality. In some cases, also the professor uh, don't want to talk about these topics because they feel uncomfortable.
Right,
So
right.
they try to avoid,
Mm,
and in some cases they suppose that the students know about this, but it also happened with all the professors, so
right.
it's not easy to get information. Yeah,
Mm,
and
mm,
sometimes the media is the way to teach to the students, as is not very is in some cases, many cases, is not the best.
Thank you very much. Thank you. Professor Mani, you have your hand is up.
Yeah. Um, this is very insightful, and I was astonished that in Mexico is it not different than a country like Egypt, uh, because it is the same. I had the same experience because, as you all know, that I'm interested in female genital mutilation, which has sexual impact, and women's sexuality is a part of the problem. Because it is aimed to control women's sexuality in these areas. So when I introduced the problem as a educational problem in the medical curriculum, okay, and I put education objectives as one in the physiology to introduce the student to women's sexuality and the cycle of sex, the professor made the same. And this is in a medical school, not in the high school, or this is in a medical school that the doctors to be will not learn about women's sexuality because the professor also didn't like to discuss that, and he ignored that objective at all in the lecture. So unfortunately, I agree with you that this is a real problem because even if medical professionals ignore this problem. Thank you for
Yeah.
adding my point.
Thank you so much, Professor Mani. Yes, this is very, very similar in many of those of the countries in the global south, unfortunately. Um, Todd asked if the paternity leave of 15 days comes with paid leave. I remember you said yes, that it comes with a paid leave. And then Ruta indicated that there's no paternity leave in South Sudan, and it's the same in Nigeria. Dr. Anton Depp also highlighted that. So the culture is that anything childbirth is the business of the woman, according to Dr. Anton Depp from Nigeria. Tara, your hand is up. Over to you.
Yeah, thank you so much. Thank you so much, Dr. Addis Ababa. This was really a marvelous presentation. And as Dr. Amani and others, you all said, it's maybe the same thing also in Sudan. I think it has to do with culture. I think more than religion. That shows that what's happening to women all across the world. My question was about violence or gender-based violence. Do you have legislations in your just judiciary system that may be strong against these issues? And also, as Dr. Amani said, is it part of your curricula in the medical field or in the health professional fields in general? So as to be like a cultural shift in the eyes of the doctors or the care givers in the first place, or not? So I was wondering what's happening in Mexico regarding this issue. And my last question is about your name. It's a very interesting Addis Ababa. Can you maybe tell us the story behind it? Thank you.
Okay, we have laws, yes, but it is not easy to implement. For example, in our university, we start promoting and some activities in order to avoid the violence, but it is not very easy to introduce. They have a lot of barriers to process, so it's not easy. We try to establish the I don't have I don't know how to do, and okay, we are trying to do, but it is not easy. And in some case, when our professionals, medical professionals or medical students are in the health services, they also face this kind of violences that hurts the salud to the patient. So it's not very easy to overwhelm. I don't know. I'm sorry, your question. And the other case is a short, but very interesting story. My mother was a secretary it was working in a place where she has to review all the news about the work that she did, and she in that time there were a lot of problems in Ethiopia, and she she read the capital of Ethiopia happened X. So she decided if one day she had a girl, she will call Addis Abeba. So the story, and then I learned that it was time of flowers, are flowers, something like that. So it's I like this story.
Thank you so much, Dr.
Yeah.
Salinas, an interesting insight. Yeah, actually, the 50 to 60% of women having experienced sexual violence is actually very, very high. And I was just wondering if it has to do with the culture of machismo. I hope I'm pronouncing that word well. And then marionismo. You know, these are traditional gender roles where men are expected to be aggressive and then women are expected to be submissive. Since we still have few more minutes, could you throw some light around this cultural, traditional gender roles that may be related to the high number of violence in the community?
Yes, and I think it's one of the situation that we need to change. We don't have to promote that kind of behaviors. It's not good for anybody. Not for men, not for women. Nobody have to be happy or to be comfortable if we are thinking that it is a way to live. Yeah, if one person is danger, is not good. We
Yes,
have to think about that, and we have to change that kind of behaviors.
very good. Thank you so much. Thank you.
I would like to answer one question. I think it is taught is paternal leave for 15 days paid leave. Yes, in Mexico is paid. Is
Yes,
paid,
it's
but
painful.
no all the men take this advantage of the leave.
Okay,
Sorry
thank you
about
very
that.
much. Yeah, any other question? And as we try to round up, please note that there's a link that is provided for you to click and fill out the information there. Just fill the form, and then at the end of the day, we'll be sending a certificate of participation to you. Within the next few minutes, Dr. Salinas, what about the role of faith-based organizations in all of this? How is that?
I didn't listen you well. Could you repeat the question?
Yes, the role of faith-based organizations, religious groups, and all of that. How are they? What role are they playing?
Yeah, they are very conservatory, but we also have a very power woman. So many groups are trying very hard in order to promote our rights. So fortunately, in our country, we are changing this kind of aspect, and I know we have to do a lot, but I think that we are doing every day our space different things in order to promote health sexuality.
Thank you so much, Dr. Salinas. Your presentation has actually helped to provide more insight into all of these issues, which are not quite different from what happens in many of our countries. So thank you so much. And dear
Godwin,
participants.
may I just speak for a while? I just
Okay.
wanted to thank, Addis, because I've been in communication with her for last 15, 20 days. And she has done a really great job. Addis, I would like to thank you on behalf of program committee for agreeing to be with us and sharing your experiences, which are similar to quite a few of the countries. And I was really alarmed about, the 50 to 60% sexual violence experience of women. And definitely that is quite high. And it was, when you said the society is conservative, but the rape culture is prevalent, we really have to think about it, how that matches. In a conservative society, the rape culture is, like promoted and normalized. So again, these things are, it needs a lot of discussion and introspection. And you have set the ball rolling very nicely. And I think we have a lot of new people also who have joined this webinar. So it is very good, Godwin, that we have such a lot of audience in this webinar. So thank you, Addis, for creating the discussion on this topic. Thank you so much.
Thank you so much. Thank you,
That's a
everyone.
pleasure.
So please look forward to our next webinar and endeavor to be part of it. I need to acknowledge two of my students who joined. I invited
Thank
them
you.
and they obliged my request. So thank you so much for joining. And everyone, thank you so much, and all the very best until we meet again.
Thank you, good queen. And Todd and everybody, nice to see you.
Nice to see you. Mhm.